So I think the way we're going to approach this tonight is by starting with the bones. Then we'll move on to either muscles or joints, and finally, we'll end with nerves. Hello, I'm Dr. Austin Chiang. Today, I'd like to discuss this topic. So let's get started. Let's jump right into it. I think you're going to enjoy this. I actually enjoy it myself because it gives us a solid foundation and background understanding. Sometimes we get sidetracked because we tend to focus mostly on nerve problems, pinched nerves, or disc issues. So today we're going to tie everything together. If we look at the bones of the body, we can see that we have many. What are bones? Bones form the structure, framework of our body. They support the body, give shape to the body, protect internal organs, heart, lungs, brain, help in movement. The human body has approximately 206 bones. Two major types of the skeletal system. One, axial skeleton. This forms the central part of the body and includes skull, spine, vertebral column, ribs, sternum, breastbone. It protects the brain, heart, and lungs. Two, appendicular skeleton. This includes the bones of the arms and legs, shoulder bones, arm and hand bones, hip bones, leg and foot bones. It mainly helps with movement. Main functions of bones: support the body, help in movement, working together with muscles, produce blood cells in the bone marrow, store calcium bone, fractures and bone pain. For example, if you look at an X-ray of the tibia and it appears broken, that is called a tibial fracture. Most bone fractures take approximately 4 to 6 weeks to heal. What does bone pain feel like? Bone pain is usually deep, throbbing, dull and aching, not sharp or surface level. It often feels deep inside the body. How bones heal. Osteoblasts build new bone and help mend fractures. Osteoclasts break down old or damaged bone. These two cell types work together to repair and remodel bone. Important warning signs. If you experience significant pain in a bone, not a joint, the pain stays in one specific area. It does not change with movement or rest. It remains constant whether you are sleeping or awake. There is no known injury or fracture. You should consult a doctor. Persistent bone pain without a clear cause could indicate a pathological condition, such as a tumor, neoplasm. In cases of cancer that spreads to bone, metastasis, bone tissue can weaken and cause severe pain. Bone pain, especially in cancerous conditions, can be extremely intense. Muscles. Muscles are designed to move bones. When you use a muscle, whether you're walking, chewing, talking, or lifting your shoulder, the muscle contracts. If you strain a muscle, it can be very painful and limit your range of motion. Strain versus sprain. Strain, injury to a muscle or tendon. Sprain, injury to a ligament. If you try to lift your shoulder and it hurts when you actively move it, it's usually a muscle condition. If someone else lifts your arm for you, passive movement, and it still hurts significantly, the problem may involve ligaments or the joint, not just the muscle. What muscle pain feels like. Muscle pain is usually localized to one area, worse when you use the muscle, reduced when you rest, sometimes burning or deep, cramping like a Charlie horse. Muscle pain generally does not radiate far from the affected area. When you contract a muscle, your brain sends electrical impulses down the spinal cord to that muscle. If the muscle is not contracting, it usually does not produce significant pain. Causes of muscle cramps: magnesium deficiency, calcium deficiency, potassium or electrolyte imbalance, dehydration, overuse, running too much, lifting heavy weights, lactic acid buildup. Hydration is very important, especially for athletes. Charlie horse tip: calf cramp relief. If you get a calf cramp in bed, do not point your toes downward. Instead, pull your toes upward toward the ceiling, dorsiflexion. This relaxes the calf muscle and often relieves the cramp quickly. Posture and muscle imbalance. Poor posture, like forward head posture and rounded shoulders, can cause tight upper trapezius muscles, tight levator scapulae, weak rhomboids between the shoulder blades, tight pectoral, chest muscles. To improve posture. Strengthen the rhomboids, stretch the chest muscles, doorway stretch. Poor posture can also affect spinal discs, internal organs due to compression, hip flexors, psoas muscles, glute muscles. Over time, this can lead to neck strain and other symptoms. Smooth muscles, internal muscles. The heart, stomach, and intestines are made of smooth muscle. If the heart doesn't get enough blood, it cramps, heart attack. If the stomach is irritated, it cramps. If intestines spasm, cramping pain. These pains are deep and uncomfortable, but typically localized rather than radiating. Muscles need oxygen, proper blood supply, electrolytes, potassium, magnesium, calcium. If they don't receive proper nutrients and oxygen, they contract and become painful. Joint pain. Common joint pain areas include knees, shoulders, hips, ankles, fingers, spine, disc, and vertebral joints. Joints contain synovial fluid, lubricating fluid, articular cartilage, smooth cushioning surface, osteoarthritis, wear and tear arthritis, caused by degeneration over time, associated with aging, excess weight, poor posture, or old injuries. Cartilage thins, bones move closer together, bone spurs may form. It usually affects one joint more than the other, unilateral. Rheumatoid arthritis, autoimmune arthritis, autoimmune disease, often affects joints bilaterally, both sides, causes inflammation and swelling. Blood test may show positive rheumatoid factor, RF, rheumatoid factor, RH factor, and joint swelling. If rheumatoid factor, RH factor, is present in your blood, it can indicate that you have or may develop rheumatoid arthritis, RA. In RA, joints swell, swelling leads to tissue degradation, inflammation persists, cartilage and bone slowly erode, joint pain symptoms of joint pain, pain worsens with movement, swelling, redness, warmth, stiffness, acute phase, apply ice chronic phase. Moist heat can help. Joint pain is usually localized, but sometimes pain can refer to nearby areas because of nerves within and around the joint. Osteoarthritis versus rheumatoid arthritis. Osteoarthritis, degenerative wear and tear disease, bone-on-bone friction, usually affects weight-bearing joints. O hips, O knees, O spine. Rheumatoid arthritis, autoimmune disease, bone erosion rather than simple wear, usually affects both sides, bilateral. Gout, most common in the big toe, caused by excess uric acid, can affect any joint, often causes severe pain and swelling. Important advice: maintain a healthy weight. Excess weight accelerates joint degeneration, can lead to knock knees, knees bending inward. Nutrition for joints. Bone broth is excellent. Glucosamine sulfate, chondroitin, magnesium, calcium, phosphorus. Natural anti-inflammatory compounds. Natural nutrition often works better than just supplements. Nerves can produce a variety of sensations: burning, tingling, numbness, pins and needles sensations, radiating or traveling pain. Sciatica, largest and thickest nerve in the body, runs from the buttocks down the back of the leg. Symptoms: pain, burning, tingling, cramping, numbness. Important: you can have sciatica without low back pain. Thoracic outlet syndrome. Nerves from the neck, brachial plexus affected. Symptoms can appear in the shoulder, arm, hand, or chest. Pain can radiate even without neck pain. Carpal tunnel syndrome. Compression of the median nerve at the wrist, caused by repetitive hand use, typing, knitting, fine work. Symptoms: burning, tingling, numbness, cramping in the hand. Relieving the nerve compression can improve both nerve and muscle symptoms. Neuropathy. Nerve cells are covered with a myelin sheath that protects them. If the myelin is damaged, as in diabetes. Numbness, weakness, loss of sensation. This affects nerve transmission from the brain and spinal cord to the rest of the body. Nervous system. The brain and spinal cord, central nervous system. Control. Heart and lungs, liver and gallbladder. Autonomic nervous system, sympathetic, parasympathetic. Hormones and endocrine system. Kidneys, gastrointestinal system, reproductive system. If nerves are irritated or compressed, it can affect both sensation and organ function. Summary: bone pain, deep, throbbing. Muscle pain, worsens with movement, localized. Joint pain, swelling, redness, stiff, localized but may refer. Nerve pain, burning, tingling, radiating, numbness. Take care of your weight, nutrition, and hydration. If pain is persistent, consult a doctor. May you and your family stay healthy and safe.